Thank you for the introduction. It's a great pleasure to be here, and I would like to thank all the members of the committee and everyone who's been involved in the organisation of what's clearly a fantastic conference. So, what I want to do in the course of this talk is to look at the symptoms of individuals with autism in adulthood, but I will be focusing particularly on individuals who are within the more able range, or at least have an IQ in the more able range. So the big question is, why do we need to know a lot more about adults with autism? The real reason is that there's a lot of focus in the research literature and the diagnostic literature on young children with autism up to the age of, say, 6 years or so, but very, very little, very few studies, and particularly very little intervention work for older adults with autism. So if I can get this to work, So if you look at some reviews of studies of autism, so sometimes many thousands of papers, you will see that most of them are on young children, a few on adolescents, but very few on, relatively few on young adults, and when you look at older people, hardly any studies at all. And this slide shows the same thing, that most of the work on autism, intervention work, focuses on preschool or early school age children, very, very little intervention work at all on adults. And unfortunately, the work that is there is often of quite poor quality. And we also know that there's very high costs involved in helping adults with autism in transition throughout their lives. So a relatively recent study, for example, suggests that the cost of autism in the USA alone is greater than the entire GDP of smaller countries across the world. And in the UK, the cost of autism is actually more than the cost of heart disease and cancer and stroke combined. So many billions of pounds per year spent on autism, and much of that cost is related to adult needs, because, of course, people are adults with autism much longer than they are children with autism. One of the issues in deciding what sort of services there should be and what the financial support for these services should be is that there's huge variability in outcome amongst individuals with autism. And even if you take those who are more able, whose IQ is in the average range, there's no typical clinical picture in adulthood. And we see outcomes that can range from people who become very successful academics or scientists, people who are involved in banking or communicating or communications industries, computers and so forth, individuals who may marry, who have families of their own, and quite a wide network of friends. At the other extreme, even amongst people who have an IQ in the average range, there are individuals who have not succeeded in finding work, who don't have friends, and who remain very dependent on their families for support. And this variability has been in evidence for many decades. And if we go back to Leo Kanner's writing, and that's over 70 years ago, you will see that he was describing his surprise or curiosities about how people changed enormously over the years from the time they were little. So that some individuals actually deteriorated during the adult years, although many managed to find, develop skills, they managed to find occupations, and they managed to make considerable social adjustments. Despite the fact that this was difficult for them, they were socially integrated to some extent. And he made the point about how difficult it is to predict from early childhood how people are going to be in adulthood. We do know that having a normal IQ is a very important prognostic indicator, but as I said, even people with very high IQs in childhood, some make fantastic progress and others make very little progress. Nevertheless, you find that if you take the DSM-5 criteria for autism spectrum disorders, you find that the vast majority of adults will have continuing social communication problems and some degree of restricted patterns of behaviour or interests and so forth. But as they grow older, as we've already heard this morning, the severity and the manifestations of these difficulties tends to change. So often the symptoms become milder. And it's that can make diagnosis and recognition in adulthood much more difficult. So these are all the criteria in DSM-5 for social communication deficits across the age range. And what you find in adulthood is there's more of a focus in the higher ability group on just certain aspects of those. So they're much more subtle difficulties. It's things like reciprocal communication and reduced sharing of interests or emotions or affect. It's not that their social approaches are totally abnormal or that they don't respond to people at all, but the way in which they respond to people lacks the sort of finesse of normal interactions. And again, it's not that they don't communicate either verbally or non-verbally at all, but the integration of verbal and non-verbal communication is impaired. So again, much more subtle difficulties. And many in adulthood do want to develop relationships and try to do so, but they do have difficulties in adjusting their behaviour to suit the ever-changing nature of social contexts, and will have difficulties in making and maintaining friends and relationships. So the core problems are there, but much more subtle than they used to be in childhood. And similarly with these repetitive patterns of behaviour, you don't tend to see many high ability adults who show lots of motor stereotypies such as spinning or flapping and so forth, but they may use rather idiosyncratic and repetitive language. They probably don't show the same repetitive types of language to the same degree, but they do like to keep to routines. They do have difficulties in coping with change and transitions. And although their behaviours may become more flexible, they may still have quite rigid ways of thinking or viewing the world. And again, you don't tend to find the sort of attachments to objects that you get with younger individuals, but they may have particularly sort of circumscribed interests about certain topics or habits or interests and so forth, and hobbies. And still in adulthood, you do often find a oversensitivity to sound or lights or various aspects of the environment. So again, the core symptoms are there, but much more mitigated and tend to focus on more circumscribed areas. And what I wanted to do in the rest of this talk really was to look at what we know happens in adulthood with these more able individuals and what happens to their autism symptoms over time, to look a little at their cognitive and language abilities, social integration, mental health problems, and then also to look at what may be done to help. Now, what I will be doing here is repeating quite a lot of what Dr. Calvo said earlier on, because I think it's very important to make the case that on the basis of a lot of evidence we have, there's a diminution in autism symptoms and behavior difficulties over time, particularly in individuals whose IQ is in the normal range. So you find an overall reduction in autism symptomatology over the years. You find particularly decreases in repetitive and stereotype behaviors and improvements in social reciprocity, and decreases too in problem behaviors, so that many of the follow-up studies that have been done show really marked improvements in individuals really from late adolescence onwards. And this is just an example. We have followed up over many years a cohort of individuals who all had an IQ in the average range as children. They were 6 years old when we first saw them, and now their average age is around 45 years old. So we've seen them many times over the years, and you can see, and this is an illustration of these improvements in symptomatology that Dr. Calvo was also talking about. So we use the autism diagnostic interview, which was mentioned, to assess autism symptoms when they were young and when they were in adulthood. And you can see the total scores on the diagnostic interview reduce, their communication difficulties reduce, their social difficulties reduce, and also ritualistic and repetitive behaviors reduce considerably over time. So quite marked changes in the level of autism. They still meet basic criteria for autism, but in many ways have shown a lot of improvement. And if you look at things like language and IQ as well, these improve over time. So some recent work by Kathy Lord shows that the vast majority of individuals do develop useful speech as they grow older. You also find that the gap between language comprehension, which is often very poor in childhood, and language expression, which is often better, that gap tends to diminish over time because language comprehension skills, understanding, also improves with the years. And IQ too is generally remarkably stable in this more able group. So in the cohort we studied over time, for example, the vast majority had an IQ when they were 45 years old or so, as they had when they were children. Some people suggest that IQ tests are invalid for children with autism because they were not designed for that group. But actually, if you use the right sorts of tests and give them in the right sorts of ways, IQ actually is a good predictor of intellectual ability later on. We had some children actually some individuals who made a big change in IQ, and that was mostly due to the fact that their verbal IQ increased over the years. But there was a small group who showed a decline in cognitive ability, and they tended to be the people with the most, who also had more disturbed behavior. But overall, IQ remains remarkably stable. the problem is what also remains stable is this disparity between IQ and self-help and independent skills. And that's also was described this morning. So you can get individuals who are fantastically able in certain ways, perhaps running the whole computer system for a company, but still have difficulties with things like tying shoelaces, or actually dealing with everyday tasks like getting your money ready to put it in the drinks machine at work and so forth. So this discrepancy between innate cognitive ability and practical daily living skills tends to persist. And this, of course, gives rise to all sorts of day-to-day difficulties. And it also makes work colleagues and other people that makes it very difficult for them to understand how somebody with autism can be so fantastically skilled in some areas, but so unable in other areas. So this cognitive dissonance is really hard to overcome. And that's probably one of the reasons why social integration in adulthood, even amongst these higher ability individuals, is considerably impaired. And again, as I'm afraid has already been mentioned, we find in this group very low rates of employment. So even with people of high IQ and often good potential skills, many of them have no job or are in sheltered workshops way beneath their real level of capacity. And their employment outcomes are much worse, for example, than those of individuals with intellectual disabilities or other behavioural or developmental disorders. And generally, if you look at their daytime activities, these are much lower quality than the educational provision they had when they were younger and in school. And particularly these adults of normal IQ are significantly less likely to have a structured or appropriate daytime activity than people with autism who also have intellectual impairments. And these aren't just sort of short-term difficulties when in the immediate aftermath of leaving school, but they tend to persist well into later adulthood. And a recent review on social outcomes in autism by Steinhausen and colleagues shows the generally quite poor levels of social integration amongst individuals with autism as they move into adulthood. So they summarized outcome into good outcome, moderate outcome, and poor outcome. So people who had a good outcome were people with a high level of independence, who were in work, who had friends, who often had families of their own, and generally only about 20%, and that's of over 800 individuals altogether in the studies reviewed. So only a small proportion rated as having a good outcome. Somewhat more having what was described as a moderate outcome, so some independence, but really, and often in supported employment, and a few acquaintances, but not many close friends. That was about 30% of the total, whereas in fact the proportion of people who were still rated as highly independent, no friends and no employment was much higher at almost 50%. And those figures vary quite a lot across studies as well. So in some studies, things were a bit better. So in some studies, almost a quarter of people having good outcome, although in others fewer than that. And in other studies, again, some people, almost 60% having a poor outcome. But I think this variability in outcome indicates that there's differences in the cohort studied, but there's probably also differences in the opportunities offered to adults, and those can make a big difference. And just to return again, I'm going back to some more data from our long-term study. And as I said, this is a study of 60 people who all had normal IQ in childhood. We saw them when they were 6. We followed them up again when they were just under 30. And then we followed them up again at 44 years, and more recently when they're 49 years. And diagnosis was confirmed all the way along. But you can see that although this was a highly selected group of individuals, the number of people with good, more than at least one good reciprocal relationship was only around 7%. Some data are missing. Some people we didn't have the information, so it doesn't all add up to 100%. So really relatively few having close friendships, and again, relatively few having close relationships or marriage or partners either now or in the past. And the majority never having specific friendships or close relationships. And the same sorts of patterns if you look at independent living. So around a quarter, around 26%, living either independently or semi-independently, but over a third actually still needing to live in highly supportive environments. And again, in employment, we had a few in professional jobs, and again, around a quarter in some type of work, around, so 28% either in skilled or unskilled work, but over half, even of this potentially able group, had never worked. And again, just to pick up again on a point that Dr. Calvo had made, what we see in autism is that these improvements that I've spoken of in terms of symptomatology, showing steady decrease over the years, but what we don't find is improvements in social outcome over time. So in our study, for example, sorry, this is too difficult to read, but the number of people living independently went up a little between the ages of 30 and mid-40s, but really only a small amount. The numbers of people in work didn't change, and the numbers of people with close friends or in relationships also changed very little. So people themselves are showing big improvements, but what's not happening is the development of supports from society to help them really capitalize on these skills. One of the other aspects that emerges from adult follow-up studies is how difficult it is to predict individual outcomes. So, for example, you can see individuals who as children look very, very similar, but as adults have very, very different outcomes. And how you can predict what will happen is still a real challenge. So just as an example here, 2 people from our follow-up study who look quite similar when they were children. One is now 55 and another is a female in her late 40s. So their IQs as children were similar. In fact, the woman had a rather higher IQ, although her language was poorer. The male was very, very disturbed as a child, very, very difficult behaviours, so much so that he needed to be placed in hospital for some time for treatment. That did help his behaviour, but he didn't have any other specialist intervention. First of all, he went to a school for children with intellectual disability, but later on he went into a mainstream school. And subsequently, as an adult, he went to university. He has a master's degree. He's been employed for many years. He's been married. He's a very skilled musician and has a wide circle of friends. On the other hand, the female, who did not show such disturbed behaviour, but she went to a specialist autism school and continued in autism provision, but really never made the same progress. She lives now in a private autism residential home, very little autonomy, never worked, and no friends. And yet, to begin with, if one had been asked to make a prediction, we would have said, well, she might well do very well in adulthood, but that he was so disturbed that he probably would not. But in fact, the opposite was true. And this, again, happens time and time again, and we still need to know what it is about the individuals or about the help they're given that really makes a difference. And I think just another interesting case is that one described by Leo Kanner. So this was the first individual ever described by Kanner in 1943. Again, very, very difficult as a child and needed to be placed in institutional care because his parents were just unable to cope. He later on went home, although his mother at the time described him as being hopelessly insane. He got very little help while he was growing up, although he did maintain contact with Kanner. But just recently, some journalists followed him up at home, and they found he lives independently in exactly the same town he was brought up in. He plays golf every day. He's got a fascination with cars, particularly Cadillac cars. And one of his big distresses in life is that Cadillac cars aren't produced in the same way that they used to be. But otherwise, and he's still quite repetitive and fixed in his ways, but other people in the community are very supportive of him, and he's greatly appreciated there. So again, a picture that's changed enormously from the time he was a very disturbed child, and in the absence of any specialist help. And some recent work by Cathy Lord, again, has just illustrated how huge the changes are. So you can get people who look very similar in terms of their social skills around the age of 18 months, for example, but who are very, very different in their social skills by the age of 19 or 20. And these different trajectory patterns are very characteristic in lots of studies. And people like Cathy Lord are suggesting that it's actually very important to research these different trajectories, because actually they may have important implications, perhaps even for the genetic understanding of autism, because they are so very distinct. Another thing in the Cathy Lord, and again this was mentioned very briefly earlier on, is some individuals who, so these are two groups of individuals who both have normal IQ when they were little, but there's one very small group, and it's only 8 individuals here, who by the time they're assessed in young adulthood are showing no social difficulties on things like the ADI, and they're showing no ritualistic activities either. So they really no longer look as if they have classic autism. And as was described, these people with these good outcomes, some people have described them as having optimal outcomes, or in Cathy Lord's group, very positive outcomes. Now, they're a very, very small group, and again, as was mentioned, although they don't meet criteria on things like the autism diagnostic interview, they still show very subtle differences or difficulties in social interaction and cognition that seem to interfere with completely independent or successful functioning. So again, some people have complained there can be recovery from autism, whereas others suggest that yes, the core autism symptoms do fade, but people are still left with some subtle symptoms that may have a later impact. The other area I wanted to mention briefly was mental health, because that is one of the issues that does become more problematic in adulthood than it was earlier on. So many studies show that both in the US and the UK, there tends to be an increase in mental health diagnoses with age, and certainly in the States, there can be a huge increase in the use of medication with age. So a study a little while ago suggested that nearly over 80% of adults with ASD were on at least one medication, and almost half were on 3 or more different medications. So a huge use of medication there. And at the same time, of course, as mental health problems increase, we find that services decrease. So I've already mentioned this decline in specialist day services in adulthood, and the fact that provision is particularly poor for adults of normal IQ. Now, there's quite a lot of debate and disagreement about the rates of mental health problems in ASD. And again, this is an area that needs to be looked at much more systematically. So some people say that virtually everybody as an adult has a mental health problem. In other studies, it's more like sort of 40 to 50%. And we do need to know what tends to protect people from mental health problems and what increases the risk. What we do know, though, is that there's much better agreement on the types of mental health problems that are experienced, with the most common clearly being depressive and anxiety-related disorders, including things like phobias and obsessive-compulsive disorders. And ADHD, too, can be a big problem for adults, although, as been reported in lots of studies, rates of schizophrenia or severe psychosis tend to be relatively low. Again, though, across studies, you've got a lot of disparity in the actual rates reported, but I think everybody would agree that depression and anxiety are real risk problems for many adults with autism. And we really don't know much about the factors that are associated with adult mental health. We've looked at things like the association with IQ, or with gender, or with age, or with how well they're doing in terms of social integration. But actually, some individuals who superficially look as if they're doing well, who've got jobs, who've got families and relationships and so forth, actually have very high levels of mental health problems, whereas there are individuals who are not doing well socially, but whose mental health seems to be really very sound. And we need to look much more about the association with external factors such as family environment, the way in which transitions, say from school to home or school to college, are dealt with and what impact they have. Lack of structure post-school is really very significant. And of course, any disturbances in home or residential life are very important. And so finally, I think we need to be thinking much more about how we can improve the lives of these potentially at least more able adults with autism. And clearly, from the literature and from people who lecture and so forth, we see some individuals who've done extraordinarily well and who have made a big impact on understanding autism and on the world of autism through their efforts. But how we can bring more people to that level is still a challenge. It's very clear that we need to be looking at ways of improving the quality of daily life. And there's been more recently much more of a focus on leisure activities, recreational activities, sporting activities, with some groups in the States now suggesting that actually focusing on recreational activities that fill the day in a useful way, rather than things like social groups or social activities per se, may be more productive. But also interventions that improve self-help and adaptive skills, mother-child relationships, even in adulthood, looking at neighbourhood facilities and daily activities may all be very important. Clearly, improving supported access to employment is very important, and it's very clear that with good supported employment programs, you find a lot of significant changes in job finding and job retention and quality of life, as well as being cost effectiveness. And just going back to the early literature, Asperger pointed out that many people, given the opportunities to work, could do so extremely well, and that a particular line of work often grew out of their special abilities. And in fact, he suggested that for really high levels of success in science or art, he felt a bit of autism was absolutely necessary. The problem is, of course, as all the statistics show, is that very few people manage to make it into work. Some years ago, we did a study on the effects of supported employment and showed that over time you could get many more people into jobs, you could get many more people into technical jobs, and using the particular skills that they had developed, often to do with their ritualistic and obsessional behaviours, could make them really very useful in the workplace. And then the value of using special interests, again, was highlighted by Kanner, and his description of people who made good progress of adults pointed out that it was their special skills that they developed over the years that enabled them to take part in other people's activities and really sort of play a part in social lives. And in fact, research has suggested that, and that's including some research we have done, quite a significant proportion of individuals with ASD, and that's across the age, the IQ range, do meet criteria for what's called savant skills or exceptional cognitive skills that could be used to help them achieve much more during adulthood, but we just lack the facilities to help people develop in this way. And that, again, is another challenge because either we find that people aren't using their skills, or, as an example, this young man in the UK who used his computing skills to hack into the computers of the White House, the Pentagon in the US, and instead of the US instantly offering him a job, they demanded that he be extradited on the basis of spying. So he'd got a fantastic skill, but without help was using it in a way that was not beneficial. So I think, just to conclude, at the moment it's very difficult to predict what child factors will make a difference to functioning and well-being in adult life. It does seem that the level of early reciprocal social behaviour is something of a predictive factor, as indeed as IQ and cognitive ability. And these have some implications for early intervention, I think, but those hypotheses still have to be tested. And on the whole, I think that probably on the basis of the knowledge we have at the moment, it's modifying the environment in which people with autism are growing into adulthood and the people living and working with them. So helping people understand the needs of individuals with autism and giving them the skills to develop the skills in the people with autism, that it's that may do much more to improve behaviour and mental health and the quality of life for individuals with autism than just focusing on interventions for the person with autism, him or herself alone. So thank you. you.